How are you doing, Alexis?
I'm doing all right.
Good.
I've got a patient who needs her IV tubing and IV fluid changed today.
Well, very good. Why does the tubing need to be changed?
Well, doesn't that prevent the development of complications from contamination? In this facility, we change it every 96 hours.
That's right. Why don't we take a look at how to change the solution and the administration set at the same time?
Sounds good.
Okay, looks like you have all the supplies you need. So what's the situation with your patient?
Well, she was admitted to the hospital with a generalized infection due to a urinary tract infection. She's been receiving IV fluids to help with dehydration because she's been experiencing a loss of appetite and fever.
Okay, so what's the new IV solution prescribed?
Let me see here. Half normal saline to be infused at 125 milliliters per hour.
Okay, let's check the solution before we head into the patient's room.
Okay. According to the EMR, the patient has no allergies. The medicine looks good. It's the correct color, the bag has no leaks, and it's not expired.
Great, lead the way.
Hi, Mrs. Kaplan. You remember Miss Sims, right?
Hi. Yes, I remember. Hello.
Hello, Mrs. Kaplan. How are you?
I'm doing okay.
We're here to replace your IV fluid and tubing for your intravenous infusion. Is that okay?
Sure.
May I please see your wristband? And your name is?
Elaine Kaplan,
And your date of birth.
February 13th, 1958.
Thank you, Mrs. Kaplan. How are you feeling?
I'm feeling okay. I just miss my grandkids, Alexis.
Oh, I hope you get to go home soon, Mrs. Kaplan. Okay, I'm going to get set up and then I'm going to get started, okay?
Okay.
All right. So I'm going to prep a new bag of IV fluid for your dehydration. I'm going to clamp and remove the old bag and tubing and then replace it with a new bag of fluid and tubing. Any questions?
Nope.
Okay. Before I get started, do you have any allergies to any medications or tape?
No to both questions.
Awesome.
Let's check the medication.
Right. I have half normal saline to be infused at 125 milliliters per hour. Okay, now I'll fill out the labels with the date and time for the IV tubing and fluid.
Here you go.
There you go. Okay, I'm just going to check this label to make sure it matches with the right patient. Okay, now that the solution bag is all set, I'll work on the tubing. I'll just take this new administration pack from the package. And make sure to clamp it.
Be very careful not to touch the port to keep it sterile.
Right. Now I just hold the IV solution container steady. And insert the spike. Oh, and I use a firm push twisting motion into that entry port, right?
You got it.
Okay.
Now, just hang the IV solution bag on the IV pole and squeeze the drip chamber until it's half filled with solution.
Okay, now I'm going to release the clamps and allow the fluid to move through the tubing.
Priming is done to remove air from the tubing. Now, close the clamp and check to make sure no air bubbles remain.
Everything looks good. Okay, now we're going to raise your bed and lower one of your side railings.
Okay, Alexis. Also, close the clamp on the short extension tubing connected to the catheter in the patient's arm.
Got it. Okay, now I'm going to remove the current IV tubing from the patient's IV and then from the IV pump.
Correct.
Now I need to insert the new tubing into the pump and program it. And I'll set the rate to the prescribed 125 milliliters per hour.
Good.
Since this bag is 1,000 milliliters, I'll program 900 into the volume so that it will alarm when it's close to being empty. Now I'm going to scrub the access cap with an alcohol wipe.
Yes.
There we go. Now I'll insert the new IV tubing into the access port.
Correct. Okay, and Alexis, let's secure the IV tubing with tape as needed.
Okay. I'll secure here,
Let me silence that for you.
and I'll replace the tape here.
Very good.
How's that look?
Great.
Now I'll open the clamp attached to the short extension tubing attached to the IV catheter. Then I'll open the clamp on the infusion set and press start.
Very good. Now, don't forget to apply a passive disinfection cap to each access site on the administration set.
Right. I'll just give each access site a good scrubbing first. Okay. Now I'm going to do a quick double check since the clamp looks undone. The site looks good. I'm just going to follow just to make sure the clamp on the set is undone. The rate is correct, and you can see drops flowing.
Okay, very good.
I'm going to dispose of this bag. Would you mind lowering her bed for me and raising her side rail?
Sure.
Thank you very much.